All right, Doc, I get this one a lot. I've got back pain. Do y'all treat that?
I get that one a lot too.
Yeah.
And so spine pain, mostly low back, some neck. We actually have several doctors that treat it, especially our sports medicine or our non-operative doctors treat it. I would tell you that of the 3 body parts that come in the most, spine is top 3 easily.
Right.
And there's some days it's number 1. Most of the treatments for the spine that we see, whether they're disc related, fracture related, in a fall, stress fracture related in an athlete with back pain that's been going on, 2 to 3 weeks or longer, most of it can be treated fairly well and fairly quickly in a conservative manner. Yesterday, in fact, I saw a patient that was a little bit older that had fallen a few weeks ago and couldn't figure out why she had such back pain. She actually had 2 fractures in her back, but was very, very stable and was doing very well. We discussed kind of a plan for management. We discussed how to use pain medicines now because she's not bad, but there's still some things she does, like a simple twist or turn that'll hurt. So we manage it. A lot of what we do, we manage it, x-ray in the office, MRI if we need to, other scans if we need to, if they're called for, but typically MRI will give us a lot of answers. Almost everybody, and I would actually venture to say minus an injury like an acute fracture,
Sure.
Everybody leaves with at least a rehab program to do at home, a physical therapy prescription to learn from a therapist how to do the rehab, or to be in rehab a little bit.
Yeah.
That'll help a lot of it. For the longest time, we have a good referral of spine surgeons, a good network, of spine surgeons that we refer to, and we definitely will continue to use them, but we've been fortunate that we hired Dr. Anderson. Dr. Anderson joined our group in February of this year of 2022. I think that adds to us to be able to have those conversations in-house and keep in touch in-house. There's sometimes that I will have a neck or a low back patient that involves spinal cord that it may be surgical and maybe not. It's a little bit in the gray. I can bounce questions off him. And so not only keeping it in-house, trying to provide the same level of care, we really want to be on the same page, not rush into any surgery, but do surgery when it's indicated.
Yeah, I think it's important to close the loop, for folks that come in, because we see so many different types of injuries. For me, as a hip and knee specialist on hips, patients frequently don't know which one's hip pain and which one's back pain, and it's even hard for us to tell with an exam. As a general rule, on the front, kind of in the groin area, almost always the actual hip joint, which is not what patients associate with that. But whenever it's on the backside, there's a lot of crossover. Frequently that's actually coming from the back, and I got to do a lot of things to kind of differentiate, all right, is that the back, is that the hip? I'll do imaging, sometimes I'll do an injection, not because I think it's going to fix the problem, because it's diagnostic. It's like, hey, if we numb the inside of the hip joint, hip feels better, it was the hip. If it doesn't feel better, it's the back, right? But now whenever those patients do have the back issues, it's great to have Dr. Anderson now in the practice who can actually help facilitate from a surgical standpoint. All right, if it needs intervention, once y'all have taken care of them from an easy non-operative side, which most things respond very, very well to, but it crosses that threshold. All right, we're looking at a surgery. Now we've got somebody in the practice that can help out in addition to all the resources we have in the entire area to take care of problems.
The one thing I noticed that I wouldn't have picked out before is having someone in-house for all of its benefits includes I can get you in quickly.
Yeah.
I don't have to wait. Usually we can get people in 1 to 2 weeks. With him, it's even quicker than that.
Absolutely.
So it's been real good. It's a real good addition, and we look forward to continue to working with him.
Very nice.